Face asymmetries. It's rarely talked about, but in fact, it's a top reason people come to see me in my clinic. Hey doc, my face is asymmetrical. I want to fix it, quote unquote, fix it.
And yes, even celebrities have it. Take a look. If we take the left side of the face and mirror it, look at the asymmetry here. Then let's look, of course, at the original. Now let's look at the right asymmetry and mirror that. We have 3 different people here. And take this example as well. Here is another one. And you see what happens when you mirror the sides of the face. Asymmetries are abundant in all of us.
There's 2 rules of today's video. Number 1, none of us are perfect. Almost everyone I see has a degree of asymmetry. It's my job when I'm doing treatments to identify it and move them towards symmetry. Number 2 is I'm not talking about new facial asymmetries that need to be investigated. Things like stroke, Bell's palsy. These are asymmetries that people have inherent in them from youth maybe. The thing is, they get worse as we age. So if you see a little change in your mouth, one side's crooked, we'll say, different than the other. A nasolabial fold, maybe one's deep, one's shallow. Your brows are uneven. The eyes are off kilter. The ears are differently set. The nose is a little bit crooked. It's a little big maybe for you. Those all get worse as we age, and that's a main driver to clinics, and that's what I wanted to talk about today. We'll talk about why it happens. We'll talk about what I do in clinic, what can be done, what can't be done. Is it worth doing? But first, let's take a little fun sidestep here, because there's something called phi, or the golden ratio, 1.61 to 1. You'll know that from lips. Lip fillers are so common, and we say, well, the bottom lip should be a little bigger than the top lip. In fact, the ratio should be 1.61 to 1. And there's many of those on the face. There's a doctor made a mask, a beauty mask that maybe you've heard of. I'm going to put my face in it. We'll see what my score is. And this is not sponsored as usual, not sponsoring some app here, but I did put my face into this app to see what I would get. You just have to be careful because you don't know what it's going to spit out at you, but I'll share my numbers called the mark card mask. There's also beauty masks or am I hot or all these things you can put your face in and determine if you are. Understand this, they're 2-dimensional. They don't take into consideration your character, your smile, those little imperfections that make you you, and what comes out of your mouth. That's one of the most important things. So if you walk in the room, maybe we'll use a number, maybe whatever I scored, let's say I get a 6 out of 10, and I walk into the room and I smile and I have character, I'm automatically an 8 or 9, maybe even a 10. So understand that before we go into this video. This is all about showing you what can be done with Botox, with fillers, with implants, with things that are minimally invasive that can maybe change your life. Why are we obsessed with symmetry? Well, a symmetrical face is associated with a more healthy person, with more attractiveness in many cases than a asymmetry that's distracting. And understand there's a concept of attractive is closer to the laws of averageness, meaning in our mind, we calculate all the different people we see and the faces that look more average or we are more attracted to.
Here you see the averageness theory claims that faces are perceived as being attractive when their facial configuration approximates the mathematical average facial configuration of the population. In other words, we're used to what we know. Conversely, faces that deviate from this average configuration are perceived as being unattractive. This is psychology study, so take it, of course, with a grain of salt. It's a study.
Okay, here's my picture, and let's first look at this is the mark card mask or the beauty mask. I score 8.95. So we know automatically this whole thing is wrong. I walk into a bar, I'm not at 8.95. But obviously, whatever angle, however this captured me, you can see I'm in my scrubs. I'm even working in my clinic that day. you can see the lines and this mask of beauty, what it calculates. I'll put a link to this mask should you want to play with it, but I don't even want you guys to go put your face in this because it is kind of maybe ridiculous, but there you go. 8.95 is what I scored. For fun, you can put your face in there if you want to or not. Let's look at the golden ratio portion, which I'm more interested in. So this is kind of cool to know. And if you're not sure of your symmetries, you can take a photo of yourself or even in a video, and you can mark off certain areas like these golden ratios. I do have a whole video from many years ago on golden ratios that you can dig up and watch, and you can study it in different studies. They use it, but you can see all the 1.6 1-to-1 ratios on my face that it's calculating. But this gives you that score. So 8.56 of symmetries of 1.6 1-to-1. Again, I don't think this is correct. And remember, it doesn't take into account movement or character. So you can go way up or way down just based on opening your mouth. I just found out only 32% of you who watch my videos are actually subscribed. Hit the subscribe button below and like. It allows me to bring you more and more great videos like this if you're getting value from them. Now, a little trivia, I'll give you the answers at the end. Who do you think, what celebrities had the most attractive eyebrows, eyes, and facial features as determined by Dr. Marquardt and this mask? I'll give you those answers at the end, but you can think about that as we go through this video. So why do we get asymmetries? Well, number one is just genetics, simply genetics. They run in families. So if someone in your family has an asymmetry, you're a little more likely to get that asymmetry. Number two, photo damage. We know it kills collagen, fat pads, and can affect your bone. So sun exposure. And remember, it's not even. You might drive the car more and get more sun from the side of the window where you're driving. Or you might have a home office that you're getting sun from one side. So you get an asymmetry of the face due to environmental factors. Smoking. There was a 2014 twin study. That's a good way to study facial symmetries and asymmetries are twins, that showed smoking and other environmental factors had a big impact on their facial asymmetry. And that 2014 study also showed an impact on sleeping, whether they slept on their back or had their hand in their face, and that would have caused pressure. So these can lead to asymmetries. Of course, age is a factor, as I mentioned. We get more asymmetrical as we age. Injury is a big one I see all the time. A lot of people may have had a dog bite. I'm from Canada. We get cut up from hockey pucks. We have scars, and that can affect the nerve and the fat pads and the skin where it's put back together. And think dentition. What do you lose when you play hockey? Your teeth. I always had to go home with all my teeth, or my mom said, don't show up at home if you lose one. So I took care of them. But if you lose dentition, it plays a huge impact on the side of your face. All my patients tell me this, and they can tell me where they've had dental work done, and that changes the bony structure of the face and, of course, gives you an asymmetry. Now, how can these be treated? First of all, they don't have to be treated. But when you're getting a treatment, I always move people towards symmetry. I'll give you a fun example here. I had 15 years ago, a rep from one of the filler companies came in. Of course, they have as much product as they need to use. And it was a he. And he said, okay, yeah, treat me, doc. And I treated him. And I said, okay, you're done. And I treated half of his face. And I hadn't even thought of it because I assessed him as quite asymmetric. And I just treated one side of his face. He said, what? I'm done. I said, yeah, you're all set to go. He goes, you didn't do the other side. And I go, well, didn't you realize how asymmetric you are? And I only did treat one side of his face because I had the pre-pictures to show him. And he could have done whatever he wanted, but after seeing the pictures, he hadn't realized that he was asymmetric. Do I tell people they're asymmetric? Yes, I do. And there's a couple reasons. Number one, I'm treating their face. So when you go home and look at yourself after treatment, you're going to see things that you never saw before. And let's say, even if you treat the upper face, people come back and go, oh, my lip's asymmetric since you treated me. Didn't do anything to your lip. You just didn't notice it before. So I point it out. The second thing is I might treat one side of the face more than the other. And until that side settles in, that's a swollen side. So it's not that I need to point out asymmetries, but it's very important. If your provider doesn't assess your face and look at your asymmetries, you're not getting a proper treatment. The consult is so important in who you go see, and it's half of what you're paying your med spa for is your consult. Not the treatment, not the consumable, but their aesthetic eye. And that's hard to teach, so see an expert. Start by something inexpensive, a home device. This is a NEWA home device. I'm just testing a bunch of these. This is one I happen to have right here, but this is radio frequency. Many of you will say, yes, I will lose a little bit of facial fat. I get some skin tightening. I love it. I hate it. Whatever it is, you can use home devices. Many of my patients will use this on one side of their face to get tissue tightening. This has a built-in safety mechanism that I'm still in the process of testing for the temperature that it gets the face to see if you get apoptosis or fat loss or just skin tightening. But I know even facial massage on one side of the face can help or decrease your fat pads depending on what you do. So there are things that people do at home, like face devices that are RF radio frequency. Of course, for rejuvenation, I like LED masks. This is labor intensive, but the LED mask is going to treat your whole face. A device like this, you can spot treat certain areas. I've even been playing with treating this on my abs, on my body, to see what that effect might be. It actually fits perfectly between your abs. So I'll update you more on these things, but no home devices, facial massage, gua sha, they can all be used. We'll talk about facial exercises in a moment and what studies we may or may not have on that, but let's talk about facial fillers. Facial fillers volumize, so they're great for creating symmetry where people were not symmetric. So cheeks is very easy. So you can make your cheeks symmetric, your under eyes, nasal, labial folds, anywhere that you want to fill, the downturn of the mouth. Understand often there's a motor movement to it. What affects or helps with your motor movement is BOTOX-like products. I like Dysport, Xeomin. But Botox-like products stop muscle movement. So if you have a crooked smile, lip fillers are so common, we can certainly change the way the lip looks by filling, but we can also change how the smile is by affecting the muscles around the mouth. And there's a lot of them. You have to be careful here. We go slow, we adjust little bits at the time.
Watch these videos if you're interested in manipulating your smile with Botox or neuromodulators.
Think your zygomaticus minor and major muscles. You have your lip muscle, a levator or a lifter, a muscle that decreases the lip or brings it down. You have a chin or mentalis muscle, many muscles that we can play with, just for instance, to reduce a gummy smile. But in this case, we're using it to affect symmetries. With a little bit of filler, a little bit of Botox, you can change the face. In many cases, you need a great provider. You go slow and then you stick with that provider because you got a routine done. So filler will add volume. Botox affects the muscle movement that can help. And many of you might say, hey, fillers aren't permanent. Well, we have something called Bellafill that was Artifil. I've used since 2006. It was FDA approved in the US in 2007 and in Canada around 2013-14, as I recall, because I went up there to train many people because we had it first in the US as Artifil, changed the name to Bellafill, and then in Canada it's now Bellafill too. Way before that, before you guys even remember, it was Articol and Artiplast, but it was refined and made better. That's a permanent FDA approved product. So if fillers work in an area but you want it forever, then that's a good choice. The problem with hyaluronic acid fillers, they wax and wane. So as it goes down a little bit or it migrates a little bit, you may notice that you need topped ups, you need to dissolve, it can change. Whereas Bellafill will last you pretty much forever and it doesn't migrate like hyaluronic acid fillers. We never use Bellafill. I would never use Bellafill under the eyes, in the lip itself, not always for vertical lip lines, but for cheeks, jawlines with an expert, nasolabial folds, this works phenomenally well. Facial implants, they can be used. They've made a bit of a comeback. I like them. They can be used. And think about a rhinoplasty. A nose job is something fairly permanent. So if for the shape of a nose, getting a nose job for symmetries, for size, that makes a lot of sense. It's a nice procedure.
Some people don't even need surgery and can get away with a liquid nose job. Watch this video if you're interested in that.
Just like the procedure for a blepharoplasty or upper lids, that's another one that's long-term, looks good, high success rate, I would say, and is good to treat an asymmetrical nose or one that you want reshaped. Now, what about facial exercise? This only makes sense because if we weaken them with BOTOX, why not strengthen them with your own natural strength by working them out, the ones that you want bigger? Well, unfortunately, it's very difficult to target these muscles. There's no data, there's zero data that I can find that facial exercises will help with symmetry. Like I said, with gua sha, with using home devices with RF, with facial massage, some of you no doubt will find a difference. But for the most of us, it's not a fruitful use of our labor. Now, I promised you an answer to the trivia question. So here are the 10 most beautiful women in the world and their golden ratio scores. Number 1, Jodie Comer, 94.5%. Number 2, Zendaya, 94.37%. Bella Hadid in at number 3, 94.35%. I'll put a link in the description so you can see, if you're interested in this, most beautiful by nose, eyes, brow, lips, and so on. They break that down. But remember, we're all asymmetric, and it doesn't really matter unless it really bothers you. But keep in mind, beauty is much more than symmetry. Now, there's 2 videos you're going to want to watch now. Number 1, I talked about bone and dentition. Here's one on the DEXA scan body scan, important for your bone. One down here on facial fat and how to avoid facial fat loss, because if you lose facial fat, it changes the symmetry of your face. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.